Hi, everybody. I'm Lori Johnson, CBN's medical reporter, back again to answer your email questions. We do this twice a week, and if you'd like to submit a question, just email us at newsanswers@cbn.org. Joining me today is best-selling author and neurologist Dr. David Perlmutter. His latest book is Brainwash. Welcome, Dr. Perlmutter.
Lori, always great to spend time with you.
Well, before we get to the email questions, I wanted to get your take on what's been dominating the media coverage lately, and that's when we might get back to normal. What's at stake here?
That's the million-dollar question. And first, how do we define normal? We're never going to get back to the way things used to be. You know, we anticipate that there are going to be a significant number, for example, of small businesses that do not come back. So things are going to be different, and there'll be some good things, I think, that are going to come out of this as well. But in terms of most people getting back to work and people getting to go back to school and resume their lives, I think, truthfully, we're still a couple of months away from that. And, you know, we have to balance what's best for our health and what is best for our economy. And to be sure, those are not mutually exclusive, because if we're not healthy, then the economy will suffer. So these are very, very difficult decisions. One thing we do know, and that is that this idea of staying out of contact with other people as best we can seems to be working. We're watching numbers of new cases starting to decline in terms of their severity, and that's obviously good news. So I think it's a watchful waiting kind of thing. I think right now, as we have this conversation, is not the time to take the pressure off. The more we do on the front end, the sooner we'll see the back end.
How do you respond to the information appearing on social media about unproven therapies?
Well, this is something that we always see when people are anxious and need something to hold on to. And I think now is not the time to abandon the principles of the scientific method, evaluating what works, evaluating what doesn't work, and certainly evaluating the safety of what we end up recommending and doing. We always want to practice under the notion of risk-benefit ratio. Now, in these troubled times, we have to look at that kind of through a different lens. We understand that sometimes we have to implement some things that might have a higher risk right now, but certainly it's not the time just to throw everything we can at a patient and hope that something sticks.
All right, let's get to the email questions. Charles asks, I think I already had the virus. How do I know?
Well, here's some really good news for Charles, and that is that we are seeing a sudden dramatic proliferation around our country of tests that aren't the nasal swab looking for the virus's RNA, but rather are looking at the body's antibodies that have been produced once a person has been infected and maybe even recovered. This looks at two antibodies. One is called IgG, one is called IgM, and it's a pretty darn accurate test. It can have what we call false positives, meaning it could look like you've actually been exposed, but you might not have been, because we've had a lot of coronaviruses in our past. And if you had a previous coronavirus infection that wasn't severe, that might trigger the new test to be positive, and you might think, therefore, you're immune. But by and large, this is a very exciting new development in the testing arena, and I think will absolutely help Charles understand where he stands in terms of infection.
Sylvia wants to know, does the COVID-19 virus stay on the body after death?
That's an excellent question. Does the virus remain on the human body after somebody has passed? We do know that in New York, for example, when they find a deceased person, that they are doing nasopharyngeal swabs, the typical test that many people are familiar with, to determine if that person was suffering from COVID-19. So that would tell us that they expect that the virus could remain available for testing even on a deceased person's body, or at least in their nasopharyngeal area. So I think the answer is not clear, but we know that in some parts of the body, like the nose and pharynx, it looks as if there does remain virus that can be sampled.
Jeanette asks, why do we not hear more about the great success that the malaria medicine hydroxychloroquine is?
I think the reason we're not hearing about the great success of hydroxychloroquine is, in this instance, with relation to COVID-19, is that it has not proven to be a great success. That would be the reason you're not hearing about it. It's being studied, and there's good reason to study it because there are some mechanisms whereby this medicine may prove helpful. We have seen it prove effective in other viral infections in the past. But the reason that we don't see it being adopted, at least here in the United States, aggressively, is because there hasn't really been significant scientific support to indicate that it is truly effective in and of itself. Several studies have shown that using this anti-malarial drug, hydroxychloroquine, in combination with a product called Zithromax, an antibiotic, has proven effective in shortening the amount of time that people are still shedding active virus. But the research on just hydroxychloroquine in and of itself hasn't yet been forthcoming.
Jenny says, I have a 5-week-old baby that I am breastfeeding. What should I do if either one of us gets infected with COVID-19?
Well, I'd say that likely if either one of you gets infected, that you're both infected. And we don't have a lot of data on what goes on with that interaction. I will tell you, though, that the medical recommendations coming out of Italy indicate that if mother is COVID-19 positive, but in fairly good health, not having any significant issues, their recommendation is that she continues to breastfeed. So I would say that the rest of their data indicates that if mother becomes quite ill, then they should be separated. But I would say if that mother is infected, likely the infant has already been infected. The good news is we know that infants and young children seem to do very well if they've been infected with COVID-19.
Well, that'll do it for now. Thanks as always, Dr. Perlmutter, for your time and expertise. And if you'd like to submit a question, email us at newsanswers.org. Dr. Perlmutter, so great to see you again.
Great to see you too, Lori. Nice to spend time with you.